So once again, we're now going to open the forum up to questions. We have had a couple of questions handed in, so I think we might get started with one of the questions that have been handed in, and it is to Minister Skinner. So we will ask her to respond to this question. And the question is, given the enormous costs associated with providing public health care to homeless people, is the state government committed to the continued support and funding of homeless health clinics like the Matthew Talbot Primary Health Care Clinic that provides a wide range of services to the homeless, significantly reducing the burden on the public purse?
I can answer that very quickly. Yes, absolutely. We very much support Matthew Talbot and all of the services such as that very wonderful one. My colleague, the Minister for Community Services, Prue Gowd, is also doing work in this space. And I should also tell you that I'm chairing a social policy subcommittee of Cabinet, which includes all of the social policy ministers. So Prue Gowd, Department of Community Services, the Education Minister, and many others, and we're working on a collaborative way to ensure that we get joined up services for people who are most vulnerable in our community. That can include people who are homeless, people who have some other disadvantage, socioeconomic, Aboriginal people, and we're developing policies and programs that cross all of our portfolios. So for homelessness, it is about providing shelter, it's providing employment opportunities, it's providing health, and we're working collaboratively on that. But also from just on the Matthew Talbot, we fund a number of these organisations that are non-government to provide these services. Those of you in the room who are from NGOs will know we've had a program looking at the NGO services it's funded by New South Wales Health. All of the services have had their funding extended. And we are now going to we're entering from September a period of inviting organisations to submit their proposals under different categories for funding into the future. And they will be, it'll be very much like the new way we're funding hospital services at the moment. Under the COAG reforms, the hospital services are funded through activity-based services, and that means that you actually get paid for the service you deliver, and that's exactly how we intend to fund NGOs. So they will describe the kind of service that they want to deliver. We will enter into a contract with them that has very clear outcomes that they have designed to do with their service, and we will evaluate that as it's in ongoing. We invest hundreds of millions of dollars in non-government services that range from the Matthew Talbot through to drug and alcohol, women's health services, and many others. And many of them are absolutely fantastic. But it's very interesting. I've met with some who have said, yes, but we've been funded for 30 years. Why would you consider not funding? Well, the answer is we're not necessarily considering not funding, but they will need to explain whether the need that existed 30 years ago still exists, because it can't be just taken as for granted. We have to be more rigorous about ensuring that the money we spend, which is taxpayers' money, is spent in getting the desired outcomes. So Matthew Talbot would be one of those, the sort of organisations that I would imagine has a very secure future.
All right, so let's open it up now to do our other general questions. Just remember, no more than two people to a microphone at any one time, and we'll alternate between microphones. And we've got our first question over here to my left.
Minister Skinner, my name's Dean DeHaas. I'm the manager at the Wayside Chapel. You've just answered a couple of my questions along the way.
Wonderful organisation.
I suppose my question was along the lines of, we're a non-clinical model. It is going to a competitive tendering model. How do small NGOs such as ourselves sit in the scheme of of healthcare as far as the government sees it.
Yeah. The size of the organisation will not make any difference. It's the quality of the services that they're providing, whether they're actually meeting a need that's clear, and if they can demonstrate that they're able to deliver it to get their desired outcomes. I don't think the Wayside Chapel has any reason to be concerned about not getting ongoing funding. But that said, it will be a process of putting in a submission that is a quality submission. I did attend a program last year that had lost funding from the government, and frankly, I was quite surprised really, because it was I know from my past experience that it was an excellent program. But the problem is they became complacent. They said everyone knows how good we are. Well, you can't assume that anymore. And most of the organisations that I've spoken to get that. They say, yeah, okay, we understand we need to put in a proper submission and it will be evaluated on its merits.
I suppose, Minister Skinner, my concern is that it goes out for competitive tender against for-profit organisations and so forth who have the scope to ride far bigger tenders and more skilled tenders than smaller NGOs. Will NGOs be supported in that process?
Yes, indeed. Can I say that before being elected to Parliament, which is nearly 20 years ago, I was the Director of the Office of Youth Affairs, and we ran many, many programs, 127 NGOs funded to run programs for us. I can tell you from personal experience that some of the most effective were small neighbourhood groups, and some of them did need support in putting their submissions together and in fact meeting their obligations. That's certainly part of the role of the ministry and the pillars that we've established that are there to support people providing health services. I don't think NGOs have any reason to fear they won't be competing with the big private operators.
All right, we need to move on. Please remember just to keep your questions as short as possible so we can be quite specific. Over here to my right, the lady is here. Thank you very much.
Minister Skinner, on 30th of May, having already emasculated the IRC with legislation, the government applied to that body for a new award that will provide a small pay increase but no improved nursing staffing levels. You continue to try to deny us 0.25% of even that meagre rise by appealing against the judgment of that the government had lost in a higher court and threatening to cut public sector health positions if you fail in that appeal. Your statement that our claim is being negotiated is clearly and blatantly untrue. That's a statement, that's not a question. Your government wages law means that no further improvements to the nursing hours or ratio system, as it's also known in the documents, can be made over the life of that award. How then can the people of southern Sydney be guaranteed that the right number of nurses will be available to provide safe patient care for them when you are refusing to improve or extend nursing hours or ratios as they're known?
Well, I'm glad you asked that question because it's actually from a pamphlet that the union has put out and it's wrong. Because by answering, well, it's on the pamphlet I've got here, it's the same information. We have not stopped discussing this matter. The person that's negotiating with the union is this person who has been carrying out that task for the last 10 years. And I had a meeting with her just this week, and that discussion is continuing. So it's not true to say we're not discussing the claims put in by the union on behalf of nurses. You ask how can nurses here be expected to provide care. Can I say it's fascinating when I visit hospitals to meet with the nurses in the wards who are saying thank you so much for the extra nurses that are now here with us on the wards. Our job is a lot easier. 4,000 extra nurses since I've been the minister means the workload is spread a lot more between more people. And that is means now we have over 47,500 people, nurses, on the public payroll in New South Wales. Now that is more than there has ever been before, more than there were 2 years ago when I became the minister, obviously. In terms of the 2.5% pay increase, that is in fact exactly the pay increase you got in the last year of the 4-year award negotiated by the last Labor government. It's the same 2.5%. It's a government policy across all agencies. It applies to everyone. It applies to members of parliament. It applies to nurses, doctors, everybody else. And we believe that given CPI has gone down, that is a fair assessment. It's the only way we can make sure that we employ the extra staff that keeps our hospital system safe 24/7.
All right, we'll move on to the next question over here to my left.
Minister, I was a bit confused by your previous answers in relation to nursing hours per patient day. Because if I went to St George or Prince of Wales, then there would be one nurse looking after the four of us, if I've got that right, because I think they've got 6 hours or something or other. If I went to Sutherland, I think they've got 5.5 or something or other, and then it depends how that gets implemented on their clinical area. That means the nurses have to look after more people. And the other thing, you said that you would be employing more nurses over the next 2 years. So I just wondered what further strategy was involved in doing that. And the other thing that concerned me was, how are we still going to meet? You mentioned funding 63,000 patient days, I think, which can only be done with employing more nurses, and also 3,000 further operations. So you have to employ more operating nurses, you know. I mean, I know the nurses at Liverpool Hospital work 140 hours a week overtime just to cope with their existing load. That's what's happening at the moment. So I just wonder how all those things can be matched up, Minister.
Let me have a go at answering it. Thank you. The number of extra emergency department attendants is 69,000, 34,000 extra overnight bed stays, and 3,000 extra elective surgery. It might interest you to know that there's similar targets that we had for this last year, and they were all achieved with the extra nurses that we put on. In terms of how the nursing hours per patient days roll out across different wards in different hospitals, that is a subject of ongoing, regular, I believe it's monthly, Director General meetings with the Ministry and the Union. So they discuss those on a regular basis, how each ward is rolled out in terms of their share of the nursing hours per patient day. So that's something that I'm not an operator, I don't deal with the operational matters of a hospital, but those are constantly under discussion with Brett Holmes and others from the union. So you can rest assured that that's not something that's just plucked out of a figure, the air. That is something that's negotiated on a one-on-one basis. And can I say that the interesting thing about the increased number of nurses that we've got, when I visit many hospitals, they tell me that they have got very, very few nursing vacancies. Now, I won't say that's across the board, but in many of our hospitals that have struggled in the past because they couldn't fill nursing vacancies, that is no longer the case. So it's all measured on the patient load, the nurse vacancies and the nursing hours per patient day that's negotiated with the union. And I have a great deal of confidence that the nurses who work extremely hard are getting a much better deal now than they were 2 years ago, and they will into the future. Thank you.
All right, we've got two people standing, so I'll take those as our final two questions, and then I've still got this written question to ask as well. So just remember, please keep your questions brief so we can get to a response. Over here to my right.
Thank you. Well, firstly, I'd just like to thank the ministers for taking the interest in the local southeastern Sydney area and coming here and fielding all and sundry questions. Obviously, not all the wheels are broken and fallen off the system, albeit there's obviously room for improvement. I'm actually a consumer that's come through the mental health system in this local area, and I would like to thank both hospitals for having me back in basically full recovery. Now, I know there's more work to be done, but I hope that I'm testament to the fact that there's a lot of good work being done in this area in that field. My question to both the ministers is, there's a move that I know governmentally is being backed at the moment, which it's very pleasing to see, for more involvement of peer support workers within the mental health system. However, I'm led to believe that the stats are that Australia-wide, the figure still sits at under 1%. whereas there's models in the USA that are very significantly higher than that. So my question to both the ministers is, at what point do you think you would be involving more peer support workers?
I'll let you, but can I just say something generally about consumer involvement? I believe passionately in greater consumer involvement. I helped to set up the New South Wales Consumer Body, Consumer Council. We funded it this year and into the future. And on nearly all of the discipline panels and bodies through the Agency for Clinical Innovation, all of them have consumer participation. All of my boards have a community representative, most of them consumers of the health system. And I think that the insights that people who've had an experience with the health system, whether it's in the community, no matter what area of health they've had, make a tremendously valuable contribution to how we design and deliver our services. And I know from my discussion with the boards, with doctors, with chief executives and others, that is a widely held view. So I want to thank you. And before I hand over to Kevin, can I say that your very sensible question is a testament to the wonderful care that you received in the health system here. Can I hand it over to Kevin?
I'd like to thank my brother for coming tonight, asking that question. No, not true. Go back to the Mental Health Commission. John Fenley's the commissioner. 4 deputy commissioners, 2 of them have a lived experience. And one of the requirements we instigated, which is in legislation, is that the consumers, people that are living with a mental health issue, lived experience, have to be front and centre in the prioritising and the decision making. So we've done that from a governance level. If we go to, say, the non-government sector, and there are 95 mental health providers in the non-government sector, probably a few too many, but we're having a discussion on that front as well. Part of their contractual arrangements, particularly with those people that are providing HASI support, that Housing Accommodation Support Initiative, which touched on the homelessness issue before, particularly people with chronic illness, people coming out of jail, people that have been in long-stay institutions. We've got about 300 people in New South Wales that are in long-stay hospitals that do not need to be there. We're starting to decant those people now into supported accommodation into the community. All those contracts with those major providers, whether it be Richmond, PRA, whether it be Uniting Care, Aftercare, New Horizons, Mission Australia, all have peer support workers. So part of what we're doing in the contractual arrangement is making sure that your issue is addressed. And having just been through 4 of those organisations with some new packages, the first person that we met was the peer support worker. So you're right, it needs to grow, and off the back of reinvesting back into community mental health, you will see that issue grow. I'll just say one more thing. If I'm a homeless mother with 3 kids, which is not uncommon, and I arrive in Hurstville, Walgett or Dubbo, it's not uncommon. But I can come to an agency, whether it be the council here in Hurstville or any part of the city, and there'll be at least 4 or 5 people that can tell me I'm homeless, I need a bed, and I need support for my family. They'll all tell me I need some help, but not one of them can give me that service. And part of what we're trying to do is recalibrate a lot of people that have been in that space for a long, long time that can tell you or me that I need help, but they can't actually give me the service. And that's part of the NGO review, which we're working our way through, and Gillian described. So peer support workers is front and central to the recovery model of care, which you're testament to. And I can honestly say that that's a commitment we've made from the Deputy and Assistant Commissioner level all the way back through. So well done and good luck.
Thanks, Minister Humphries. And our final question from the floor.
My name's Dr Wayne Cooper. I'm the Chair of the South East Sydney Medicare Local. I'd like to begin by thanking Greg Stewart for his very succinct presentation on the expanding interface between the local health district and the Medicare Local and the engagement that's occurring in that level. I think the fact that Medicare Locals have been mentioned several times tonight is probably testimony to the value of this new entity. And I'd like to put the question to you, Minister Skinner, in regards to, we've been concerned in Medicare Local land about some of the utterances that have come from the Shadow Health Minister in regards to the possible future for the Medicare Local if the coalition is successful at the next election. And I think that has raised some concern about us. Particularly, I think the last comment was that they would be for review if they were successful. I'm very interested to hear your opinion, your view from the state government as to your opinion about where the Medicare Local sits in the system.
Thank you. I can say that I've had a conversation briefly with the Shadow Minister federally about Medicare Locals, and he tells me he has absolutely no intention of doing away with the primary health care services provided. It might be the structure and how it works. Can I say that, and Peter Gonski will confirm this, that I have said to the board chairs when I meet with them, and I meet with them quarterly, and it's a full-day meeting, that I've encouraged much greater partnership with Medicare Locals. I think it's the future of healthcare. I think we should have seamless care where people have access to primary health care, just as Greg has described, and then they might have an acute service then back out into the community. So I've been saying to board chairs, you need to develop those strong relationships, partnerships. I'm quite happy to look at pooled funding. We've got some models of care that are being developed in some of the districts with Medicare Locals, and that's something I've very strongly encouraged going into the future. And I believe that whether it's whichever party is in office in Canberra will support that approach. Maybe the names will change, but I don't think the idea of getting much better integrated, seamless provision of care through primary, GPs and all of the allied health and others into the tertiary level, that is definitely the way that everyone wants to go.
All right, and a final question for the Minister, one that was handed in here. When are you going to restore funding to subacute care rehabilitation services at Sutherland Hospital Allied Care Group?
I think this might be some of the money that's been ended through the NPAs, is it? Yes. The National Partnership Agreement, which was part of the COAG funding arrangement with the Commonwealth, ended. Some of it ended on the end of last financial year, June 30, $110 million. And we were not successful in negotiating with the Commonwealth Government to have that funding continued. So we have made a provision in this year's budget to pick it up ourselves. So the state government will be continuing all of those programs with state government funding.
All right, thanks, Minister.